Shoulder arthritis generally refers to damage to the smooth cartilage that covers the ends of the bones. The cartilage gets worn away, causing the rough bone ends to rub against each other. This leads to irregular motion within the joint and the development of bone spurs called osteophytes, which are bony growth formed as the bone tries to heal itself. Irregular motion and bone spurs, along with inflammation, can result in pain and loss of motion in the shoulder. There are two joints within the shoulder that can be affected by osteoarthritis. The main joint that provides most of the motion is called the glenohumeral joint or GH joint, which is where the arm bone or the humerus meets the shoulder blade, the scapula. The other smaller joint in the shoulder that does not provide much motion is the acromioclavicular joint or the AC joint, where the collarbone connects to the scapula. The cause of osteoarthritis, OA, in the shoulder is usually referred to as being either primary or secondary. Primary OA refers to arthritis with no identifiable contributing factors, whereas secondary OA is being a result of an injury or disease. The most common complaint of someone with shoulder OA is pain and loss of function. Pain over the back of the shoulder is usually due to glenohumeral arthritis, whereas pain over the top of the shoulder is usually caused by acromioclavicular arthritis. The pain worsens with activities, especially with any activities that requires the arms to reach over the head. In addition, the motion of the shoulder can sometimes feel like grinding, also known as crepitus. As the bones rub against one another, an individual can gradually lose motion, which further limits their ability to do their daily activities. Fortunately, not everyone who develops arthritis develops pain and loss of motion. In fact, some people with severe joint destruction have very few symptoms. Shoulder osteoarthritis can be managed by surgical and non-surgical treatment options. The main surgical option is a total shoulder replacement. In cases of severe arthritis, it may provide pain reduction and allow patients to increase their activities of daily living. Shoulder replacements tend to work better on older individuals who have low demand on their shoulder. Fortunately, there are a number of good non-surgical treatment options available for symptoms of osteoarthritis of the shoulder, including exercise, activity modification, physical therapy, non-steroidal anti-inflammatory drugs, also known as NSAIDs, and intra-articular injections. Hot and cold treatment can also provide some relief. While cold is helpful for reducing swelling, especially in an acute injury, it can also be helpful for chronic pain or for the pain and inflammation of an arthritis flare. For aching shoulders without acute inflammation, heat may be helpful instead. Exercise can be a useful way to help manage arthritis symptoms, but it's important to be careful with certain activities. Shoulder arthritis can be aggravated by heavy lifting or overhead activities. However, reducing activity too much can be detrimental, and it's important to maintain strength and range of motion in joints affected by arthritis. You may find non-impact activities such as Tai Chi or water exercise helpful, as they can support range of motion without adding stress to the joint. Regular exercise of the shoulder muscles can help reduce pain, support healthy cartilage, as well as increase range of motion and function. The human shoulder is the most mobile joint in the body, giving it a wide range of motion, but this mobility makes the shoulder joint unstable, forcing it to rely on its muscles to compensate for the instability. Keeping your shoulder muscles flexible and strong through regular exercises and activity can help decrease pain and increase function. When you have osteoarthritis, OA, of the shoulder, It's important to stretch and to strengthen the surrounding muscles to provide more support and reduce stresses around the joint. Remember to warm up before any exercise routine to help increase blood flow and flexibility. A 10-minute walk or other slow-paced aerobic activity can help get your muscles ready. When practicing shoulder exercises, make sure to maintain the proper form and use modification when necessary to avoid straining your joints. When you have shoulder OA, improving your overall posture will allow your shoulders to move in all directions more easily. It's always important to be aware of your posture and correct any misalignment. Maintaining good posture is important while you perform your daily activities. This exercise aids in general relaxation and pain relief of the shoulder. Stand in front of a steady chair or countertop. Leaning slightly forward, place your left forearm on the top of the chair or the countertop for support and let your right arm dangle freely. Let your right arm gently swing from side to side, back and forth, and in small circles. This should be done in a pain-free range using only gentle, free movement. Repeat on the other side. Do this for approximately 30 seconds to 1 minute on each side, 1 to 3 times per day. This exercise helps to stretch the shoulder joint, aiding in overall flexibility and ease of performing activities of daily living, such as reaching into a kitchen cabinet. Lie on your back with your arms at your side. Slowly lift both arms up and overhead until you feel a gentle stretch in your shoulders. Slowly lower your arms back to your sides. If this is difficult or painful, try holding a broomstick in both hands across your body. While holding the stick, slowly lift both arms up and overhead until you feel a gentle stretch in your shoulder. Slowly lower your arms back to your sides. Perform this exercise 5 to 10 times, 2 to 3 times per day as pain allows. This exercise helps to stretch the shoulder joint, aiding in overall flexibility and ease of performing activities of daily living, such as combing your hair. Lie on your back with your arms at your side and your elbows bent to 90 degrees. Hold a broomstick in both hands across your body. While keeping your elbows bent, use your right hand to push the stick towards the left side, making your left forearm rotate towards the surface you're lying on. You should feel a gentle stretch in your shoulder. Slowly return to the starting position. Repeat on the other side. Perform 5 to 10 repetitions, 2 to 3 times per day as pain allows. The rotator cuff muscles are small, but very important to maintain the integrity of the shoulder joint. By keeping these muscles strong, it will decrease pain and increase function. The rotator cuff muscles need endurance, more so than maximal strength, because they need to work every time you move your arm. The shoulder has many muscular attachments, and it's important to work on all muscle groups within a pain-free range. The strengthening exercises we'll be talking about are isometric and isotonic. Isometric exercise is a type of strength training that involves contracting the muscles without visibly moving the joint. Isometric exercise is done in one position, keeping the joint stable rather than moving through a range of motion. Isotonic exercise is a form of strength training that involves contracting a muscle while moving a joint through its range of motion. This can be done using weights, resistance bands, or your own body weight. Stand with your right arm by your side and the elbow flexed to 90 degrees. Reach across your body with your other hand to grip the outside of your right forearm. Try to pull your right hand towards your abdomen while resisting the movement. You should feel your shoulder muscles contract in your right arm as you push against the opposite hand. You could also use a door frame for resistance or a fixed object. Standing sideways with your affected size against the door frame or fixed object, bend the arm you are exercising to 90 degrees and push the back of your fist into the frame. Keep your elbow tucked into your side. Start by holding 5 to 10 seconds. Repeat on the other side. Do this exercise 3 to 5 times on each side. Build from 1 to 3 sets as tolerated. Attach an exercise band to the doorknob of a closed door or a fixed object. Start with the light band. Your spine should be straight and tall, your core muscles tight, and your shoulders relaxed. Hold the band into your right hand. Bend your right elbow to 90 degrees and keep your elbow tucked into your side. Pull the band away from your body, keeping your wrist in the neutral position, bringing your right forearm outwards and squeezing your shoulder blades together. With control, bring the band back to the starting position and repeat. Start by doing 5 to 10 repetitions, building from 1 to 3 sets as pain allows. Repeat on the other side. As you get stronger, progress the band to greater resistance. Stand with your right arm by your side and the elbow flexed to 90 degrees. Reach across your body with the other hand to grip the inside of your right forearm. While keeping your elbow tucked in, try to push your right forearm away from your body while resisting the movement. You could also use a door frame for resistance instead. Stand facing a door frame with your right elbow bent to 90 degrees and your right palm against the frame. Try to push the palm of your hand into the door frame. Start by holding 5 to 10 seconds. Repeat on the other side. Do this exercise 3 to 5 times on each side. Build from 1 to 3 sets as tolerated. Attach an exercise band to the doorknob of a closed door or to a fixed object. Start with a light band. Stand sideways with your right arm closest to the door or fixed object. Your spine should be straight and tall, your core muscles tight, and shoulders relaxed. Hold the band in your right hand. Bend your right elbow to 90 degrees, and while keeping your elbow tucked into your side, pull the band across the front of your body, moving your right hand towards your opposite elbow. With control, bring the band back to the starting position and repeat. Start with 5 to 10 repetitions, building from 1 to 3 sets as pain allows. Repeat on the other side. As you get stronger, progress the band to greater resistance. Stand facing a wall with your right arm by your side and your elbow bent to 90 degrees. Your right fist pointing towards the wall. Place a small pillow or towel between your fist and the wall. Keeping your back straight, push your fist forward into the pillow toward the wall. Remember to keep breathing during this exercise. Start by holding 5 to 10 seconds. Repeat 3 to 5 times, building from 1 to 3 sets as tolerated. Repeat on the other side. Stand in a split stance position with your right foot in front of your body and left foot behind. Step on one end of an exercise band with your right foot and grip the other end in your right hand. While keeping your elbows straight, slowly raise your right arm up and away from your body as far as you can go without pain to a maximum of shoulder height, then slowly return to the starting position. Start with 5 to 10 repetitions, building from 1 to 3 sets as pain allows. Repeat on your left side. Stand sideways with your right arm against a wall. Keep your right arm by your side and your elbow bent to 90 degrees. While keeping your back straight, push your right forearm outwards toward the wall. Remember to keep breathing during this exercise. Start by holding for 5 to 10 seconds. Repeat 3 to 5 times, building from 1 to 3 sets as tolerated. Repeat on your left side. Stand with your feet shoulder width apart. Step on one end of an exercise band with your right foot and grip the other end in your right hand. While keeping your elbows straight and your palm facing forward, slowly raise your arm sideways away from your body as far as you can go without pain to a maximum of shoulder height, then slowly return to the starting position. Start with 5 to 10 repetitions, building from 1 to 3 sets as pain allows. Repeat on your left side. Stand with your back against a wall with your right elbow bent to 90 degrees. Place a small pillow or towel between your elbow and the wall. Keeping your back straight, push your elbow into the wall. Remember to keep breathing during this exercise. Start by holding for 5 to 10 seconds. Repeat 3 to 5 times. Build from 1 to 3 sets as tolerated. Repeat on your left side. Attach an exercise band to the doorknob of a closed door or a fixed object. Begin with your back straight, your knees slightly bent, and your abdominal muscles tight. Facing the door or the fixed object, hold the band in your right hand. Keeping your elbows straight, slowly pull the band backwards, then slowly return to the starting position. Avoid rotating or bending your trunk. Start with 5 to 10 repetitions, building from 1 to 3 sets as pain allows. Repeat on your left side. The scapular muscles help provide stability to the shoulder. This exercise will help with stabilization of these muscles. Stand tall with your heels and back resting against the wall. If you're able, also allow your head to rest against the wall. While keeping your abdominal muscles tight, push your shoulders back into the wall, trying to bring your shoulder blades together. Start by holding 5 to 10 seconds. Repeat 3 to 5 times, building from 1 to 3 sets. Tie the middle of a resistance band to the doorknob of a closed door or a fixed object to produce 2 separate ends. Stand tall with your back straight and your shoulders pulled back while breathing deeply. Holding one end of the exercise band in each hand, bend your elbows so that your forearms are at 90 degrees angle while keeping the upper arms at your side. Facing the door or the fixed object, slowly draw your elbows backwards, squeezing your shoulder blades together. Start by holding the position for 5 seconds, then relax. Start with 5 to 10 repetitions and build from 1 to 3 sets as pain allows. While facing a wall, place your hands on the wall at shoulder level with elbows straight. Lean into the wall and perform a push-up against the wall. Keep your shoulders down and away from your ears. Do 5 to 10 repetitions, building 1 to 3 sets as pain allows. Performing these exercises as a regular routine can help reduce pain and improve function over time. Remember to warm up before exercising with some slow-paced aerobic activity and cool down after. For more tips on staying active and self-managing your arthritis, visit the Arthritis Society website at arthritis.ca.